Hi everybody, I'm Bridgette Allan. I'm a registered nurse and my primary focus is diabetes education. So what I do mostly is coach patients on how to follow a low-carb lifestyle to reverse their disease. And I'm going to be chatting at the Nutrition Network conference next month in Cape Town on the day-to-day challenges that patients face, patients and practitioners actually, when implementing a low-carb lifestyle. I feel that this conference is a really important one for healthcare practitioners to attend. If you are interested in helping your patient reverse lifestyle disease, then you need to know about the ins and outs of low-carb living. I remember 3 years ago when we started advocating a low-carb lifestyle for our patients, we were literally floundering in the dark. Although we followed the low-carb lifestyle ourselves, we found that when implementing it for our patients, we came across a whole lot of challenges that we hadn't expected to come across. It was very difficult to reach out to any fellow practitioners too, because 3 years ago this was still very controversial, and we had a real fear of being reported to the Health Professionals Council for dishing out unconventional advice. So for those of you who are wanting to advocate low-carb living to your patients, this is a fantastic opportunity to learn the ins and outs, the intricacies, the legal aspects of it, to have sure footing when giving your patients advice on how to follow a low-carb lifestyle. I particularly wanted to reach out to nurses. For some strange reason, when a conference is advertised for healthcare professionals, many nurses assume that it is doctors. This is not the case. This is for all healthcare professionals, allied healthcare professionals. Anybody who has an interest in the health industry, it's really important that you're able to effectively give out the information about low-carb living. So nurses, you are the people that come into contact with patients the most. It doesn't just have to be in a hospital setting. Many of you are primary healthcare practitioners, so you are the only people that come into contact, the only healthcare professionals that come into contact with patients. And it doesn't have to be just diabetes nurses. Those of you who are in private practice, I know that there are renal nurses out there, there are midwives working with pregnant ladies. Those of you wound care specialists, diet is very important when it comes to wound care. So I'd like to extend this invitation particularly to nurses to come and join us on the 9th and 10th of February in Cape Town and learn about low-carb living. So I'd actually like to extend this invitation to all healthcare practitioners, whether you have already started advocating a low-carb lifestyle or whether you're still thinking about it, a little bit on the fence there. Come and join us for the 2 days, find out exactly what it is all about, interact with like-minded professionals. And yeah, I hope to see you all there. It would be lovely to meet some new faces.